When you ask patients what they like about MIC, they'll tell you a couple of consistent things. Number one, they're easy to get to. Number two, our nurses are the most caring, compassionate people that you could ever find.
When you're here, you feel a little bit more normal than you would when you go to a hospital. The hospital is it's to treat sick people. And when you're chronically ill, you don't want to feel like you're sick. You want to feel like you're well. And that's what we try and help you here to maintain that level of wellness.
We have an infrastructure and a process that allows us to take a physician's order for an infusible drug, whether that be an antibiotic or a biologic agent, interface with the patient, the insurance company, the patient's geography, find the best place for that patient to get infused, and do it all quickly.
The patients that come in for their infusions, they're with us years and years and years. So you become a part of their lives.
Oh yeah, MIC is special because of the employees. They always treat you wonderfully the minute you walk in the door.
They offer all the services I need for my medical needs. Any extra needs or any issues, they'll help you work through them, whether it be different treatments, and really make you comfortable, make you feel at ease, especially if it's something that you're not comfortable with.
We do have a very convenient infusion room. We make sure that everything's at hand's reach, where you don't have to walk across a hallway or walk across a room. So it's very good for patient care that you're getting everything done for the patient right away, not having to leave the patient looking for a piece of equipment or looking for this or that. Everything's right there for you.
Some of the treatments that they provide are rather expensive, and some of the different drugs have rebate programs, and they do a great job in making patients aware that those are available and actually helping them throughout the process of completing the various forms.
The best part of my job is calling the patients, telling them that they're approved. These patients are waiting to hear from us to get the approval so that they can start the medication to hopefully help their symptoms. Also, explaining to them their benefits, what their coverage is going to be, and if there is any out-of-pocket expenses, giving them the resources so that they can get financial assistance through the programs. So ideally, they might not have to pay anything out of their pocket, and they can get the medicine to help them to be well again.
It's difficult to go to the bigger hospitals because you're dealing with traffic and parking and making sure your parking pass is validated. I think it's a little bit of that personal experience where you're seeing the same nurses all the time. You get greeted at the front, you're not walking back and trying to find an elevator or trying to find a lobby, and I think that's what makes it more of a personal experience for people.
What I enjoy most about MIC is our ability to take care of a larger group of patients.
We do make people feel at home.
They're in good hands.
I think MIC goes above and beyond.
They're very friendly, very professional, and they do a great job.